Hi, I'm Sherrie, the founder and CEO of APOPS, the Association for Pelvic Organ Prolapse Support. When women are first diagnosed with pelvic organ prolapse, they're often very confused about which practitioner to see. Who do they go to for help? I thought it would be helpful to clarify some of the layers involved in the POP arena. First and foremost, the majority of women will be diagnosed by the primary care practitioner, or PCP, or OB/GYN, who does their pelvic exams. You may go into your doctor with specific symptoms like chronic constipation or incontinence, pain with intimacy, and you're trying to find out why you have those symptoms. And in the process of that, pelvic organ prolapse is discovered. The next step is to see a specialist in the pelvic floor pathway. A fellowship-trained urogynecologist or urologist is your best bet for the next layer to go to. These are practitioners who have spent extra years studying the pelvic cavity. It's their arena, it's their area of expertise. Once you have a definitive diagnosis of the type or types of pelvic organ prolapse you have, because often women have more than one type. There are 5 types of POP, and it's very common for women to have 2 or 3 types at the same time. So once you have that diagnosis and you know what you're dealing with, you know what types you have and what degree of severity you have. There's 4 levels of severity. You have your type and your grades analyzed. Then you take the next step forward with treatment. And it's helpful to seek counsel with a pelvic floor physical therapist. They're the ones that utilize the treatment options. And this can tell you more definitively if you want to have surgery or not. If you're in an aggressive stage of pelvic organ prolapse, you may want to go to surgery right away, which was the case for me. I had 3 types. I was grade 3. I wanted surgery right away. But if you're not ready for surgery yet, it's important to explore treatment options to find out which is the best path for you. And a PT or a physiotherapist can help you figure that out. They can utilize multiple treatments to help you understand the condition and see if there are ways you can improve it. There are also other therapists available to help you. There are biofeedback therapists who specialize in biofeedback therapy. There are myofascial release therapists who specialize in MFR, which is soft tissue. There are nurse practitioners who specialize in pelvic floor and urology who can help you as well. So you have many, many options. And once you have checked out some of the treatments, it's easier to recognize if you want to have surgery or not. Additionally, a pessary is a device that is often utilized for treatment of pelvic organ prolapse, and a urogynecologist or fellowship-trained urologist can fit you for a pessary as well. Oftentimes, the PCPs and OB/GYNs will fit you for a pessary. There will be a separate video clip on pessaries specifically, so I won't get into that in detail here. What's important is that you know you have many, many options. I encourage you to go online and find information about pelvic organ prolapse. There's a considerable amount of information on the APOPS website on the library page. Also, there is a section like POP 101 that you can go to. And if you're first hearing about pelvic organ prolapse and you haven't been diagnosed, I encourage you to look at our POP risk factor page. It has a questionnaire you can download, go through, answer the questions one by one, and take that questionnaire to your healthcare practitioner to help definitively figure out if you have POP or not. I'm hopeful this is helpful for you. Look to our other videos for more information.